cellulite. Did you know that doing things just like sitting for prolonged periods, how you sit, the chair that you're sitting in, the clothes that you're wearing, the socks that you're wearing, the food that you eat, the stuff that you're drinking, the stress that you're under, and your hormones, all of these things have a major impact on how prominent your cellulite is. That lumpy, bumpy cottage cheese stuff that shows up on your thighs and elsewhere, and it makes us very insecure. It's probably the reason why you're not comfortable sometimes wearing shorts or maybe sleeveless shirts, whatever it is. Marketers love to prey on women's insecurities.
Easy to take vitamin that makes your cellulite go away.
You want to snatch your waist and also get rid of some of your cellulite, you should be using your foam roller.
You've got cellulite on your legs, you have to try this. Get your brush out.
You're dealing with cellulite or stretch marks, I would definitely grab this now.
Product that actually gets rid of cellulite. Palmer's Cocoa Butter Up.
I have made huge gains on my cellulite over the past couple of months by using these two products.
It's no secret that massage helps with the appearance of cellulite.
And because of that, there are so many ridiculously dumb, overpriced, scammy things that they sell to women to convince us that it's going to reduce the appearance or erase the appearance of cellulite. Well, girlfriend, I am here to help you out. I'm going to be very honest. And today, in this episode, I'm going to share with you what really does work, what doesn't work, what does work but only temporarily. I'm also going to share with you tips and tricks so if you've got it, which most of us do, it'll help you to camouflage it. What things, if you're actually like past the point of a coffee scrub and you're like, no, I need a surgical intervention, you're in luck. I'm actually going to cover some of that too. So whether it is you're looking for the best exercise or just a temporary fix because you've got something you need to do this weekend and you just want to make sure that you're very comfortable in a short skirt, I got you. We're going to cover all of it today here on The Chalene Show. Hopefully you find it very reassuring to know that 90% of women have cellulite. And I would love to see these 10% of women who don't. I think I did see a woman once in one of my fitness classes who didn't have cellulite. I was like, what is going on here? What is this? I'll tell you what that is. That's genetics. Most all of us have cellulite. So first, congratulations. You are a part of the cellulite sorority. And yeah, membership is free. Aren't we lucky? The good news is, you know that I always shoot straight with you. So yeah, I have dealt with cellulite, and when you are forced to wear super duper tiny micro shorts and there's a camera zoomed in on your thighs, it can really play with your head. It can make you feel insecure. So yes, I have less cellulite today than I did maybe 10 years ago, which is kind of surprising to me, but it's because I've made some serious lifestyle changes that I'm going to share with you today. By the way, last week, I just want to thank so many of you who became subscribers to the show. It's free and it means a lot. And I would love to invite you right now. Just take a moment and click that subscribe button. Click the like button on this video. Subscribing is free, which is kind of weird that we're so like stingy sometimes with our subscribe, but it would mean a lot to me. And it's one of the ways that I can ensure that this type of content is getting to the right women who want to learn this stuff, women who don't want to be scammed and want to hear an honest voice from a woman who's been there. So thank you for subscribing. I'm going to share with you what works from a science-backed standpoint, what's temporary, again, what's a complete money suck. And if you're like, girl, I am past the point of squats, like I need a serious surgical intervention, I've done my research and I can tell you that in 2025, there are some new procedures that are really, really promising and they take less than 40 minutes. I'm like, Anyways, I'm going to cover all of that. But before I do, I think it's important that we break down what exactly is cellulite, what type you have, how it's different from one person to the next. Because if you understand the type of cellulite you have and what you're dealing with, it will actually help you to better evaluate what techniques, what lifestyle changes, and what treatments are going to work the best for you. And you can completely avoid the Instagram scams. Okay, so here's the deal. Cellulite is not about being lazy. It's not about being obese. It's not about eating too many tacos. But yes, these things can impact the appearance of cellulite. So let's be very clear. The less you're moving, the less circulation you have in your body because you're sitting for a prolonged period of time. That circulation or lack thereof can increase the appearance of cellulite. And yes, even very fit women with very low body fat, like you can see that their abs are ripped, but if genetically their mom or grandma or whoever carried more body fat on their lower half, typically the hips and thighs, buttocks, they are very likely to have cellulite no matter how lean they get. So we carry body fat. We need it to keep ourselves alive. The more body fat you have, it's not that you're putting on more fat cells, but those fat cells get bigger. So the higher our body fat, the more pronounced the cellulite is going to be. And the reason why this is true more so for women than it is for men is because our connective tissues are different. Men's connective tissues are kind of like crisscrossed, so it provides like an enforcement. Think about it. They just tend to have more muscle. Their connective tissues are slightly different than ours. Ours are more parallel. Like think of them as like, ours are kind of like a fence posts. So it's real easy for things to push through. And that's typically what you're seeing is as your fat cells are expanding, and they can expand because you've gained fat, or they can also expand because you're retaining water, inflammation. So that's important to recognize. These are things that make the appearance of cellulite more pronounced on women. When we go through certain periods of our life, like, let's talk about menopause, but let's go all the way back. Puberty. Puberty is the first time when the fat cells really start to puff up and we see pronounced cellulite. The next time we see pronounced cellulite is, of course, if there's a weight gain, but a shift in hormones, such as during pregnancy. And then once again, how lovely. It happens to us once we hit like perimenopause and menopause. All of a sudden you'll wake up and you'll be like, what is going on? Like I used to love my legs and now maybe you're uncomfortable wearing shorts or a sleeveless top. And that is, again, because our hormones impact, specifically estrogen, impact the body's fat storage and how we're storing fat and the appearance of fat. Estrogen also impacts our body's connective tissue. It impacts our body's and our skin's elasticity and ability to hold in moisture. And the reason why cellulite appears like divots and dimples in many cases is because of those connective tissues. Now that's really important to be aware of because when we start talking about the things you can do from lifestyle perspective, you're reducing the appearance. But when we talk later in this episode about some of the procedures that are now available to you to literally lift those connective tissues so that it's no longer creating those divots. And the reviews and effectiveness of some of these new procedures are quite remarkable. Spoiler alert, they're also quite expensive. Now, as I mentioned, as I'm sure you know, genetics plays a major role when it comes to the appearance of our cellulite. There are women who can literally eat very processed food, drink margaritas, be super stressed out, smoke cigarettes, and they still look airbrushed in a bikini. But for most of us, those kinds of things are going to give us our cellulite a more pronounced appearance, as will salty foods and poor circulation. Poor circulation can happen for any number of reasons. If you're sitting in a chair for prolonged periods of time, I can guarantee your cellulite is going to be more pronounced. I don't know about you, but like when I'm sitting in a really hard, uncomfortable chair, I can almost feel my cellulite forming. It's one of the reasons why, as I'm recording this podcast right now, I am standing and you'll see that I'm moving and shifting my weight from side to side. I no longer spend hours sitting on my laptop, which I used to do. So when my cellulite was much more pronounced, I would hit the gym really hard for an hour, but the rest of my day, I was pretty much sedentary. And it didn't really dawn on me how sedentary I was because I was a fitness person and I was exercising. But when I wasn't exercising, I was just sitting. And we spend so much time inactive, we don't realize it. So if I had to pick like one thing that I think has probably made a huge difference, well, there's probably two, But if I, okay, two things that made the biggest difference in my own reduction of the appearance of cellulite. Number one would be buying a walking treadmill. And doing my work at a slow pace on my laptop keeps the blood flowing. It's not a workout. It's just what we call neat calories, non-exercise activity thermogenics. I would say the number two thing would be strength training. So the more muscle you build in your lower body, the less cellulite you're going to see. It doesn't erase it, but what it does is it creates a recomposition of your body fat to lean tissue. The best exercises are not just like doing leg circles. You need to build muscle. So be careful who you're taking advice from. If you're no offense if you're a 23-year-old naturally thin Pilates instructor, but we need to build muscle. And to build muscle, the best exercises for you to do that are hip thrusts, squats, walking lunges, deadlifts, RDLs, Bulgarian split lunges, and hip abduction. Really just anything where you're building the large muscles of your lower body. Regular movement, reducing your intake of alcohol, reducing your intake of processed foods, reducing your intake of foods that are very high in sodium, as well as strength training. Those things are going to make an overall difference, but it doesn't happen overnight. It's probably going to be at least 6 months before you start to see a noticeable difference. And the only way you're really going to know is if you're taking photos in the same light, at the same time of day, at the same angle. But let's talk about creating a quick fix. Like you've got something happening in a week or two, and you're like, I need a temporary solution. You're in luck because your girl loves a good magic trick, and I'm all for it. Half of the time, I think we notice it more than anybody else. I never notice another woman's cellulite. And if I do, I'm excited. Like I'm like, yes, she's real, she's normal, she's human. I don't think men notice it either. I think we just see it on ourselves. And you know what? It is what it is. So if we can reduce the appearance of it and it makes us feel a little bit more confident, why not? One of my favorite tricks to reduce the appearance of cellulite is tanning it. Like put some self-tanner on those thighs. Let me tell you, everything evens out when we can just add some nice self-tanner. If you're not familiar with self-tanners, I'll share some of my favorites below in our show description. You can get them on Amazon. Another way that you can disguise the appearance of cellulite, and this one is brilliant. I love it, love it, love it. That is a good body blur. My favorite body blurs, you can put them on in literally like less than 2 minutes. And wow, look at the difference in my legs. I mean, this is moments apart, like seconds later, and I have far less appearance of cellulite. And my skin looks even and flawless. I'm a big fan of either Westmore, Tinge is another one I love. I hope I'm saying the name correctly of those two. And then if you're looking for like a super affordable option, I don't like the color as much, but Sally Hansen Legs, it's so cheap and it's available at the drugstore. By the way, every year I do a series of free like Zoom trainings. You can call them webinars or live tutorials. And I am going to do my very first ever Get Ready With Me Live. Now, if you haven't caught some of the videos I've done in the past, sharing my tips and tricks and beauty hacks, my magic tricks as I like to call them, those videos are great. And many of you have said, I can't figure this out. Can you show me exactly how you do that thing? So I'm going to do a Get Ready With Me. I'm going to do a whole series of videos based on subjects that you said you wanted me to cover in depth, but interactive, meaning you can be there live and asking me questions. So depending on when you're watching this, I would love to invite you to attend one of these live get-togethers. To get signed up for one of my live tutorials, all you have to do is click the link below in our show description. Or if you're watching here on YouTube, you can open up your phone, take a screenshot of the QR code. You can open that up in your camera roll, and all you have to do is give me your email address and I'll send you a link. It's going to be super fun. Another very effective temporary fix is getting rid of the inflammation. So you can do this very quickly, like in just a couple of days, by obviously reducing your intake immediately of inflammatory foods, cutting out the salts, maybe even doing a sauna or a body wrap with a lymphatic massage. OMG. Have you ever done lymphatic? Like, I can't even tell you. They are legit. Doing lymphatic massage is going to reduce the appearance of your cellulite, guaranteed, immediately. Right after your massage, you're going to see a noticeable difference. So you would want to do it on the same day as your event because, within 24 hours, the water comes back and you're going to see that cellulite again, but it's a wonderful temporary fix. Now, as we age and our skin loses elasticity, kind of like sags, you're definitely going to see more cellulite, right? Like, so, when you squeeze your legs and you can see cellulite, the same thing's happening as our legs and arms start to lose elasticity. So by pulling the skin up, you're going to see less elasticity. How would we do that, Chalene? I've got a solution for you. Now, these things are pretty decent, and let me tell you, there's a trick to using them. The trick is use rubbing alcohol on your skin first to remove any oils, any lingering lotions or castor oil, and then you add these little, they're not little, they're pretty big, like these adhesives. You first apply it to the top of your thigh, and then you pull up and you attach it higher on your body. Now, they're decent, but would I feel comfortable dancing in them all night? Probably not. I mean, it's a temporary fix. It's great for a photo, walking into the restaurant, but I wouldn't make it a crazy dancing on the table all night, sweat fest. They're great for the ta-da moment, you know what I'm saying? Or like when you're walking into the restaurant. They're wonderful short term. I don't think they're sweat proof. So it's not something I would wear if you're going to pull an all-nighter dancing on the tables in Las Vegas. Now, you've probably heard something about the caffeine rubs. I looked up these studies on these, and there is decent statistical significance to the reduction in the appearance of cellulite using these caffeine scrubs. I don't know why. I think it has something to do with pulling the water from the skin. So it's just temporarily reducing the appearance. I will say it's definitely a minor improvement. It's definitely not as major as using one of those skin stickers, but it does work. And it's scientifically proven to reduce the appearance. But again, and I can't reiterate this enough, the most important things that you can do are lifestyle. It is cutting back your alcohol. It is reducing your inflammatory foods. It is getting enough sleep. It's managing your hormones. And guess what? Not only will that reduce the appearance of your cellulite, here's the crazy thing. When you do all those things, including strength training and moving more, you're going to live longer. You're going to look younger. You're going to have less chances of dying from any disease. You're going to have a reduced risk of having cancer. So even if it feels like, oh, that's kind of disappointing because I'd have to wait 6 months to see a difference, it's worth it. Those 6 months are going to pass anyways. So if just by making those changes to your lifestyle, and you don't have to make them all overnight, but by making these subtle changes and really thinking about them, you are improving every single inch of your body, not just your cellulite, and you're improving your ability to age powerfully. And isn't that what it's about? But I know that you have been waiting for the actual treatments, the ones that in 2025, as we're moving into 2026, are the latest improvements when it comes to the surgical or in-office treatment of cellulite. And for these options, I went directly to the expert, Melinda Farina. She is the plastic surgery consultant that you definitely want to invest with. Her agency, what they do is they research all of the latest trends and techniques and doctors, because just because somebody is super famous on Instagram does not mean that you can trust them. Okay. And if you're going to consider doing a surgical procedure of any kind, don't just go off of a friend's recommendation. Your skin is different. Your needs are different. Your aesthetics are different. So I went directly to her and said, okay, I need you to shoot straight with me. Because when you ask a doctor, they're going to say the thing that they're doing. You know what I mean? She sees all of it. She sees the nightmares. She sees the people who have the horrible experiences, and then they have to find a doctor to repair things. And so here's the breakdown. Aveli, I hope I'm saying that correctly, Aveli is one of the latest techniques. Then there's Selfina, cellulase, and radiofrequency. According to Melinda, the most important thing for you to understand is what type of cellulite you have. And then once you know that, then it helps you to understand, number one, which surgeon you should choose and which technique is best for the type of cellulite that you have. So if you're ready to separate the science from the scams, keep watching. The first surgical technique that we want to talk about is Avelli. This is a newer, minimally invasive, it's a device-based procedure. They use a very thin, small, handheld tool that's inserted under your skin. I've watched quite a few of the videos. It seems it's very graphic, but apparently not very painful. What they're doing is going under the skin and actually like lifting or breaking up the septa or the bands, the connective tissues that actually cause the dimpling. Now it's done in a single session, anywhere from 25 to 45 minutes, and the results can be seen immediately. You can go back to work in like 1 or 2 days, just a little bit of soreness, a little bit of bruising. They say you cannot exercise for up to 4 weeks. Good to know. Less bruising, less downtime, and longer lasting results than previously used techniques, which are perhaps more common. And the previously used techniques, we're going to talk about those in just a moment because, again, this is a relatively new procedure. It is FDA approved. Pricing, I could find on doing a little bit of research, anywhere from $2,500 to $7,000. Now, why the big discrepancy in pricing? Well, obviously, supply and demand. You're doing something in New York City versus Arkansas, you're going to pay different prices. I do think it's very important to remind you when we're talking about any type of procedure in office, you want to go with someone who is very reputable. And I've learned the hard way that you just can't trust the recommendation of a friend or even lots of friends or reviews or even after meeting the doctor. I just think it's such a serious decision if you're going to do a cosmetic procedure that you save up the money and invest in someone who's going to vet that surgeon for you. They're going to look into their background. They're going to see if they have lawsuits. They're going to look at other patients' results. They will be familiar with their bedside manner, and they can match you with a practitioner who fits the aesthetic that you're looking for and also help you figure out in advance before you go see them what your options are and what you should be paying. All those things are so important. Trust me, it is worth every single penny. And I don't get paid $1 to say that. I just have helped so many people avoid having a nightmare. Anyways, Cellulite is one that's been around for a lot longer, and that's an advantage, right? So we have more evidence and more results. It is FDA cleared. It is also a subcision procedure, meaning they're going under the skin. It uses a vacuum-assisted device that kind of uses like a microblade that releases the septa, releases those fibers, those connective tissues. Again, relatively painless. Apparently, the only part that's kind of painful is getting the local anesthesia, like, the shots. It's just a single session, and the results can last up to 3 years and beyond. The next procedure you might want to consider is Cellulase. Cellulase is a laser-assisted surgical treatment. Apparently, it melts away the fat and it cuts away the fibrous bands, and it also stimulates collagen production. So apparently it gives a nice smoother effect long-term. That combined with radio frequency. Now, radio frequency is non-invasive, yay! And it's a treatment that uses heat and energy, and you treat the skin so that it boosts collagen, and it usually offers a really nice result, but it tends to be more of a temporary result. I'm kind of interested in that one. Anyways, here's the truth bomb. There is no single one treatment that's just like, okay, here it is, it's the cure. And when I spoke to Melinda in preparation for this episode, she did say with her clients, she's seeing the best results when they combine a few different things. That she said that's when the magic really happens. And that combination therapy is really determined by what type of cellulite that you have. So let's talk about that. 4 different types of cellulite. Number 1 is soft cellulite. This is what you noticed probably when you were just hitting puberty. It's a little bit looser, a little bit more of a jelly look almost, kind of like not smooth, but not as dimpled and bumpy and lumpy. You might see your legs jiggle a little bit when you walk. This is very common when you gain weight. It's also common if you just have a sedentary lifestyle. And then there's hard cellulite or fibrotic cellulite. This is cellulite that's very firm. The dimples and bumps, it's like they don't move. It's very hard. And this is the most stubborn and most difficult form of cellulite to treat. And then there's cellulite that's from edema, like swelling. And this, ironically, is one of the easiest forms of cellulite to treat. And there's some great procedures to help reduce the appearance, including really simple stuff like lymphatic massage. And then lastly, there's flaccid cellulite. Now, flaccid cellulite is typically what you're going to see as you're aging. So it's when, you might have very low body fat, and this can be very frustrating. But you're like, wait, how come my legs look kind of like wavy, or the backs of my arms look kind of like wavy? This also happens after significant weight loss. And as I mentioned, it can certainly happen with aging and in the perimenopause, menopause stage of our lives, because we just start to lose that elasticity. And a great solution for that one is some of those temporary solutions. Again, like, just doing a body blur or the tape that pulls your skin up temporarily. But the best thing that you can do of all is just accept that we all have it. And there's no shame in wanting to reduce the appearance of it. That's great. I mean, as I always say, do you, boo? Are you kidding me? I am the queen of all of the tricks and the magic and the strings and the potions and I love creating the illusion that I don't have these things to deal with. You know what I'm saying? And there's no judgment in that. You can accept yourself exactly as you are. And just because you want to camouflage some of these things doesn't mean that you don't accept yourself and you don't love yourself. Think of it as crafting. That's how I think of it. Lastly, the most important thing you need to remember is that perfect doesn't even exist. And no one cares about these things except us. So if it makes you feel better to camouflage these things, go for it. But you're really going to feel better about yourself when you feel strong on the inside. You know that you're making the right decisions and you're doing things to help yourself to age powerfully. Some lumps and bumps or smooth skin, it doesn't make you better or worse than anyone else. And, if you want to do a procedure, there's no judgment. You can do whatever makes you happy. We have to stop judging what other people want to do. If that makes you feel confident, if that allows you to love the body that you're in, then go for it. But just know this, don't stress about this stuff too much, because we worry about it way more than anybody else. I love you, not because you're lumpy or bumpy, or not because you are smooth as silk. I love you because I know you're a great person. I know you're funny, and I know you're smart, or you wouldn't have made it all the way to the end of this video.